I'm Carolyn Honia, owner and lactation consultant at Lake Norman Breastfeeding Solutions. Today, I'm here with a mother and baby to demonstrate paced bottle feeding. Afterwards, we'll talk about which kind of bottles to choose for your baby. Place the bottle nipple on your baby's upper lip and wait for them to root. When they root, place the bottle in their mouth and adjust it to help them get a deep latch. Both of their lips should be flanged, and it should appear that they're attached to the base of the bottle nipple and not the tip. Hold the bottle parallel to the ground and listen to your baby's rate of sucks. If they're gulping quickly, lower the bottle until the nipple is only half full of milk. This helps them pace the milk flow. You should see your baby take pauses every couple of sucks to take a breath. You know that you're doing it correctly when baby pauses to breathe every couple of sucks. This is called paced bottle feeding, and it's better for baby's oral motor development because it indicates that the baby is able to use their strong suck to pull out the milk rather than it auto-flowing in their mouth. They have more control this way over their suck, swallow, breathe as well, so it's a more respectful way to feed baby because it gives them more control over the flow of milk and their breathing. And finally, it reduces frustration when baby goes back to the breast because baby will be used to using their strong suck on the bottle just like they do at the breast to help express the milk. A lot of families worry about there being air in the nipple because right here you can see it's only about half full of milk. But that's really okay. As long as the baby is upright like she is, she can choose between breathing and swallowing, and she won't just swallow the air in the nipple. Just like us, if we were drinking from a water bottle and there was air in our water bottle, we wouldn't necessarily swallow it. So she's doing fine regulating it just like this, even with air in the nipple. And a good rule of thumb is for it to take babies about 5 minutes per ounce. So a 3-ounce bottle like this, we would expect to take about 15 minutes. If the baby's, hungry and has really good oral motor skills, longer is fine too. If they're still young or if they're sleepy, it can take a little bit longer sometimes. Good job, little one. I recommend choosing a smaller bottle that holds 5 ounces or less. Look for a slow flow nipple and a nipple that transitions from a tip gradually out to the wide base. One of my favorites is the Mama bottle. I like it because it has this nice gradual slope going from the tip to the base. What that means is that baby is able to wrap his or her mouth around the base of the nipple and cup it with their tongue. And when they suck, they make a wave-like movement with their tongue. Some of the other bottle nipple shapes that have a harsh transition from a little nipple tip out and down, we call that the shoulder appearing bottle nipples, can be really challenging for babies to maintain a deep latch on the bottle. They have a hard time gripping that shoulder and they tend to back up to the tip of the nipple. Some examples of those brands would be the Komotomo, the Avent, or the Tommy Tippy. If you're using those bottles, watch really carefully to make sure your baby is actually latching to the base of the bottle and that it appears like their tongue is cupping the nipple. If they're struggling with it, or if you're buying bottles for the first time, then choose ones like this. The Mama is a great example. Even Flow Balance is another bottle, and they come in glass as well. And sometimes the Dr. Brown's bottles can be appropriate for preemie babies that have a really small mouth and need an extra slow flow. Otherwise, go for this one or the Even Flow Balance. Choose the slow flow nipple and the smaller size.